Hi everyone, welcome back to my YouTube channel. So in today's video I wanted to share my C-section experience with those of you mamas who are worried or just want more information, have my experience with you guys to share. It's a fairly simple experience that I've had since my C-section was not emergency, it was planned because of a breech baby. So I wanted to kind of explain how my experience went and hopefully give you an idea of how it is for majority of mamas out there. So let's go ahead and get started. Okay, so my goal was to do a hospital birth with an epidural. I didn't want to try doing unmedicated birth. Initially that was my goal, to do an epidural. I spoke with my doctor and I told her that that is my plan, so I could get the epidural on time. And because I've heard stories where some women wait as long as they can without an epidural and then they get an epidural too late, that it just doesn't work. So that I didn't want to do that, I wanted to avoid it. But at my 20-week ultrasound, the baby was breech, and the doctor did tell me that this is too early to tell, that they move around so much back and forth, and it's just too early to tell. But because I had other high-risk diagnoses, I did have to get an ultrasound at 28 to 30 weeks either way, not because of the breech baby but because of marginal cord insertion. So we had to do that, and in fact that ultrasound did show that the baby was still breeched. So from there on I became a high-risk patient because of the breeched fetal presentation. So I had to get another ultrasound, but this time not with the ultrasound technician, but it was with the doctor in the office. And that was around 34 weeks, which was my regular routine prenatal visit. And once again, baby was transverse or breech presentation, back and forth. I think at that point the baby was transverse, which is lying across the belly. And at this point they said there's still a chance the baby will move. We'll plan on regular birth from as of right now, vaginal birth, delivery, and then at my 36-week visit I had to come back again in the clinic, and they did a quick ultrasound. Once again, baby was breeched, and at that point we decided our options. They told me that I can do external cephalic version, ECV, which is when you go into the hospital. It's an inpatient procedure because of a high risk of placental rupture, uterine rupture, fetal. The baby can have a risk of the heart rate dropping, so it has to be done in a hospital operating room. Most of the time they do give you some fentanyl, opiate medication for pain, but my doctor said he doesn't give any medication for that because he wants to be able to know that if there's some extreme out of the norm pain, that's not normal, that's a reason to be concerned about something, possible rupture, I suppose. But me and my husband talked to each other and talked with our physician, and we decided that we're not going to do a external cephalic version because I didn't feel like, even though the risks are low, I didn't feel like they were worth the risks. I didn't feel like I wanted to risk any bad things of happening. And on top of that, the success rate of ECV is extremely low. There were just not many things that gave me reassurance to even try external cephalic version, so we opted out of that. So at that point we did schedule a C-section for 39 weeks. So that's when they do a scheduled planned C-section of 39 weeks at my doctor's practice, which is Kaiser. And we went ahead and did that, scheduled it, came in weekly after that for a quick ultrasound with the doctor, and baby remained breeched. And so at 39 weeks, well, I was, according to my calculations, I was 38 weeks, but because I was doing fertility tracking, ovulation tracking, so I knew exactly when I got pregnant, but the doctor said it doesn't matter to them. I was 39 weeks. I came in the morning of my C-section. It was scheduled for 1 p.m. and I came at 10 a.m. So the night before, starting at 8 or 10 p.m., I can't remember, I was instructed to not eat any food, no water, no drinking, absolutely nothing by mouth, and take a shower, no shaving 3 days before, because that can irritate your skin when you use a prep wipes for disinfecting your skin. So the night before I showered, and you're supposed to not use any lotions, and they give you 2 packets for each time to wipe yourself, a neck down all the way to your toes, wipe with a sticky material wipes. I can't remember what they're called, but they're surgical prep pads. And I did that, went to sleep. The material the wipes are very, very sticky, and they just don't feel good on your skin, but they are supposed to disinfect your skin of any pathogens, microbes, or anything like that. So I went to sleep. In the morning I woke up, again, no water, no food, got ready. I was extremely nervous, of course. This is a C-section. I have seen C-sections as a nurse, which gave me extreme anxiety, because I know how they performed the procedure, and I could replay it over and over in my mind, and it was just giving me extreme anxiety. But I was trying my best to not focus on it, because it had to be done. There's no way around it. So we drove to the hospital. We did not have to go through the emergency department. We could, but we did not have to. Just keep in mind, if you do, there's an emergency room associated fee. So you don't have to if it's scheduled. Go to the front desk, surgery check-in. Most hospitals, I assume, are the same. So that's what I did. I signed paperwork, my insurance, registration, paperwork, the whole process. And then I went up to the birth center, and they let me in. I already had a room waiting for me, and a nurse assigned. So I came in, signed papers, gave them my birth plan for the baby, and then I had to change into a gown and once again wipe myself with those same antibacterial wipes. And I forgot to mention, the morning of, I took a shower also, and I had to wipe myself with the neck all the way down to my toes. And then again in the hospital twice. So I did that, and then I just was waiting. They did some fetal monitoring, where they put the belt around your belly to monitor if you're having contractions. I didn't. And if just the baby's movements and heart rate. So they kept it on for a little bit. Nothing crazy. Did my vitals, intake, paperwork, lots of questions. And then they did my IV. They started saline, and 1 hour before I had to get antibiotics. Just 1 hour standard procedure antibiotics before surgery. And then my doctor came in 3 hours before surgery. So the doctor came in and checked on me with the ultrasound. The baby was, in fact, still breeched. So we also did this in the clinic a week before, doing paperwork for C-section risks, which is, it sounds very scary, possible hysterectomy if they can't stop bleeding, possible, surgery overall is scary to consent to, because there's so many risks and factors that go along with it. Although very rare, you still have to review them and sign the papers. So we did that one more time, and it was pretty quick. She did a quick assessment on me, and then after that, the anesthesiologist came in, did her assessment, and from there on, we just waited for about an hour in the room until surgery, and right on time, about 1 o'clock. They weren't running behind, they were a little bit ahead. The nurse came in, the anesthesiologist, and they took me into the OR. I walked over there with my husband. Some anesthesiologists don't allow your husband or partner to come in until you are already prepped on the table. But this particular one knew I was very nervous, so she encouraged him to come in with me at the same time. So you lay down right away. They prep your belly with more antibacterial wipes, and then they start your catheter, urinary catheter, and it goes very, very fast from there. The anesthesiologist is hooking up to a cardiac monitor, and they put a nasal cannula in there for oxygen, put a little finger pulse oximetry to monitor your oxygenation and your pulse, blood pressure cuff. They start prepping everything. It goes very, very, very fast. There's so many people in the room that you don't even have time to panic. Like, on a scale of 0 to 10, I thought it was going to be a 10, how scary it would be. But because you're so distracted, it was about a 2. Mainly because I just didn't have time to focus on my fear. There were so many people around, so much going on, so fast. And they do their best to comfort you. So they were talking about how excited I am, what the baby's name is going to be, asking all kinds of distracting questions. And yeah, then the doctor comes in, she's waiting in the corner, everyone's continuing to talk to you. And then it's time for a spinal block. So with regular vaginal birth, you get an epidural. With C-section, you get a spinal block, which is a different medication and a different spot of your spine that blocks your nerves, blocks inside out, that you can't feel anything. So you sit down and you have to bend over like this, and you kind of have to arch your shoulders over with your head down like that. And there's a nurse next to you, in front of you, and she's holding you down, kind of like face to face, holding you down, just talking through the procedure with you. Breathe, don't tense up, continue breathing, focus on other things, just stay calm and collected. And let me tell you, that was insanely painful for me. Other people told me there wasn't painful, but mine was just insanely painful. I don't know why, but the anesthesiologist did say she had a hard time puncturing my skin and my muscle with the needle because it was very hard. She said there's nothing to be concerned about, but she just had a hard time getting through. So I imagine that's why it hurt really bad. Almost immediately you start feeling this hot sensation on your feet, and I didn't know what it would feel like, so I didn't think that, oh, this is because I'm getting the medication in my body. I thought someone's like blowing hot heat on my feet, or like they put a hot wet towel around my feet. That's what it felt like. And then it slowly starts traveling up your legs, and then you just kind of become limp. Your legs become limp, and then they just lay you down. It's the weirdest feeling ever. Like, in my brain, I know I can move my legs, and I'm trying so hard, but they're not moving. So they lay you down, they start draping you, and from there on it goes very fast. Like, I couldn't even tell you the details. Next thing I know, the baby's already out on the table, everything's happening so fast. I hear the baby crying, and next thing you know, they're patching me up. But I do have to point that out. When they were sewing me up, there's a lot of pressure because they're pushing down and they're trying to squeeze out a little bit more blood out of your uterus. and sewing it up. And then I felt extreme, almost like paralyzing pain in my shoulders, like from my diaphragm up. And that really scared me, but the anesthesiologist said that's because there's air entering your the cavity, and your diaphragm is sort of like freaking out, I guess, because there's not supposed to be air outside your lungs in the diaphragm cavity, and there is, and it's just kind of spasming. So that was weird. I did not like that feeling, but once again, it went by pretty quick. And then they just take you back to your room, do the assessment, skin to skin. It goes very, very fast. And after that, they start giving you medicine for pain, change your bed pad that you lay on. You stay in the room, in the birth center room that you were admitted in, for an hour. And they check your vitals, check on you and the baby every 15 minutes for 1 hour. And if you're stable, they will go ahead and move you downstairs or upstairs, wherever the unit is in your hospital, for mother and newborn. And then they check on you every 30 minutes for an hour, and then every hour for 4 hours. Your might be different, your hospital, but that's how my hospital was. And then after that, every 4 hours, 6 hours, 8 hours. And then depending what time you have given birth, since mine was middle of the day, the pediatrician came in the morning the next day. So of course they check your baby, the APGAR score has to be okay or good, 8 or 9. So as long as that's within limits, and 1 minute mark and 5 minute marks, there's no need for immediate pediatrician attention. So that's basically it. The next day, of course, you're in pain. Within 12 hours, you have to have your urinary catheter out, and you have to go pee. Within 4 hours, I believe. I could be wrong. Maybe it's an hour. I could be wrong. I can't remember. But I know I was not able to pee at all. I was just not able to pee. I tried my hardest. I wanted to, but I couldn't. So my two options were to get another catheter, which would have been a straight catheter that they drained the urine immediately, or they gave me nalbuphine, which is a pain medication, but actually works, I suppose. That's what they told me. It works to help you pee. So they did an IV push of nalbuphine, and I just remember burning my arm. Like, it just felt like it was burning, going through my vein. And then within a few minutes, like, your private area is just burning on fire. And I don't mean to scare you, but I'm just sharing my experience. It felt like it was just burning. And then I went to pee, and I did pee like a full liter or two. Once again, because I didn't pee for so long until after they took my catheter out. And I had to drink a lot of water too, and ice chips. And so that was good. And then it didn't hurt to pee. It just hurt in that overall area, but as you're peeing, it doesn't hurt. And since it's a C-section, of course, you don't have that burning sensation as you would after vaginal birth, with tearing and everything being so swollen and sensitive over there. That's that. And then they do come pretty frequently and press on your uterus. Even after C-section, they still do it. It hurts pretty bad, but it's doable. You get through it. Everything's fine. To get more blood out, to help your uterus contract and shrink faster. And that's that. Let's see if I can remember anything else. And it's been about a year, almost a year since my C-section. Yeah, after I didn't have any stitches on the outside. They stitched it up on the inside, but not on the outside. And there was no surgical glue, no gauze. When I went home, they just cleaned it off and sent me home. They said you can shower. Open to air is the best method of healing for uncomplicated, uninfected surgical wounds or surgical incisions. And within about month, I believe, it was already sealed up on the outside. And then I will say about 2 months I could not pick anything up, so not even the car seat. It just hurt. And you know, it is a big surgery, there's a lot to say to that, but they do give you oxycodone to take home and ibuprofen, but oxycodone made me feel very loopy, so I didn't take any. I just took ibuprofen. And the healing goes pretty fast. You know, in the moment it feels like it's very slow, but when you look back, it all flies by. So there's just focus on your baby and your healing, your well-being. Get all the help that you can. Ask for help. Don't be afraid to ask for help. You will not regret it. What else? So at 4 or 5 weeks postpartum, I went in for my checkup with the doctor that did my C-section. Everything was fine, and she does resume you to your, you can have intercourse after that, as long as everything's fine and no concerns. And you can resume to moderate, lightweight physical activity at your comfort level, of course, if you would like. But your situation is different, of course. This is what my experience was. And then that's it. I never went back. I emailed my doctor if I had any questions, which I felt like 1 week was good. Like, I felt like the pain was going down, and then the next week was like more pain than the week before, which was weird. You would think that each week would be less and less pain, but with they said with C-section healing, it can be like fluctuating. So it's not day by day. It's 1 week can be this certain amount of pain, and then the next could be more pain, even though you wouldn't expect that, but that's normal. As long as not severe pain, there's no drainage from your incision, everything looks good, it's not swollen or red more than normal, then you can assume that everything's good. But of course you do check in with your doctor when in doubt. And that's basically it. The healing went pretty fast from there on out. And about 6 months postpartum is when I resumed physical activity. I didn't have the motivation or the drive or the energy to do it any sooner because of the sleepless nights, of course. But I did resume fully back to normal at around 9 months. So 6 months I started lightweight, and then 9 months is when I started to do a program, tone it up. 6 days a week I did working out for about 5 or 6 weeks. And then now I'm doing, starting Kayla BBG workout, Kayla Edsains. She has a sweat program. So that's what I'm doing. I lost all of my baby weight, but my body is not the same, of course. I do have stretch marks, saggy skin, like the belly mom pooch, I guess. So just because people tell you one thing doesn't mean that's how it's going to happen, because people said you will snap back within a month, and it did not happen. It took at least like 6 months. So finally, right now, I do feel like my normal self, and it's 11.5 months since I've had my C-section. So that's basically what my experience was. I'm sure I'm missing a lot because there's just so much that goes into it, but I think I did share majority of the main information with you guys. So if there's any questions, please ask me in the comments below. I will try my best to answer them or guide you, direct you to resources that I found helpful. And ask me any questions, anything I missed. I will do my best to answer that for you guys. So if you are a mama who's scheduled for a C-section and you're terrified, just know it goes by so fast. Everything is, it's worth it for our babies. Everything's gonna heal, everything's gonna go back to normal, everything's just temporary. So even though it sucks in the moment, you're scared, you're in pain, just know it goes by so fast, and you look back and you don't even remember what happened. So just stay hopeful, stay positive, and just focus on the good, that you're going to meet your baby soon and it's all going to be worth it. So once again, I hope you enjoyed this video. I really hope it's answered some of your questions, gave you some relief from anxiety, I hope. And if there's any other videos you'd like to request for me to do, let me know in the comments below. If you would give this video a thumbs up and subscribe to my channel, I would love some input on what kind of video topics you'd like for me to make next. But that's basically it. I am very passionate about obstetrics, women's health, so I do plan on making a few videos like how I got pregnant, how to increase your fertility naturally, and pregnancy essentials, things like that. So if you're interested in any of those, once again, let me know, and stay tuned for more. Thank you for watching. Bye.